I'm here to tell you a story about Anka. When I became pregnant with Anka about 2 years ago, I realized if an Oxford-trained child psychologist needs a tool to help her track her baby's development, a lot of other parents will need help too. Fast forward 18 months, this is Anka today, and I just used my own tool to detect she indeed is suffering speech delay because she's hearing 4 languages at home, which is pretty common nowadays, especially in Silicon Valley and any other city. First 3 years of life is especially important because that's when our human brain is growing 1,000 neurons a day, and it's reaching 90% of the adult size by age 3. And unfortunately, story like Anka is actually really common. According to the CDC in America, 1 in 4 kids under age 5 have developmental delays. This number increased to 1 in 3 in China, 1 in 2 in India. So it's very much a global public health issue that we're targeting. In America, problem is compounded because 60% of the pediatricians, family doctors, nurse practitioners don't have the time to do a full evaluation. This is why every single year, there's 1 million kids entering our school system with an undiagnosed disability every year. This is why Babynoggin is creating this end-to-end child health service. We allow parents to self-screen at home. We then connect them to their doctors for referrals and specialists, connect them to local support systems to receive free intervention, and ultimately harnessing that at-home behavioral data from birth every few months for the life of that child. I used to teach child psychology at Oxford, was formerly a healthcare VC. My co-founder, Jonathan, has over $1 billion in exits. Famously, Baby Center got sold to J&J. And head of engineer came from NASA bioengineer and built apps for Fortune 100 companies. So we're a team to take this scale to internationally anytime. So the app is quite simple. Parents tell us how old the baby is. Based on the child's age, we give you tailored developmental surveys that detects delays in speech, motor, autism, social-emotional, cognitive ability, and the list goes on, because we're adding on more tools. And it's completely customizable for pediatricians, insurance companies, and so forth. Doctors in America also using our tool can earn upwards on average of $50,000 by collecting health insurance reimbursement using our tool. This is why we're charging them a monthly subscription rate. And currently, our customers include community health centers, pediatric clinics, hospitals, and our printing contracts include life insurance companies and major children's hospitals as well. Perhaps what makes us even more unique is our endorsement from the CDC, Steve Ballmer's group, and also Jeff Bezos' Family Foundation, and as well as Chen Zuckerberg's primary school. Because they understand if you want the highest ROI for health, you start from the get-go and as birth. That's what we do at Babynoggin. So parents who download our app, 80% will download them after a pediatrician referral, 90% of them will complete a screening. And we recently also have an independent review from Lancet, what's by far top 3 medical journal. We also have gotten tons of inbound international interest because this is very much a public health issue that we're trying to solve, including from China, Israel, Chile, New Zealand, Ministry of Health. So with that, we're closing a seed round, and more than that, we're hiring a lot of roles. So if anyone's interested, please contact me. And I want to end with Anka. She's fortunate to have her mom as a child psychologist. A Babynoggin would want to help every single child to have that access. Because according to Nobel laureate James Hackman, investment in early childhood is the highest ROI a society can do for itself. For every dollar you put in, you get $17 in return. So please join me to help every child reach their full potential. Thank you so much.